Empowered Respite by Colin Tran. This capstone project will address designing with mental health in mind for healthcare and school environments. Mental health is about our cognitive, behavioral, and emotional well-being. It determines how you think, feel, and act in our everyday lives. Things that can impact our mental health, such as trauma, abuse, loneliness, poverty, stress, and so much more, can lead to mental illness. Unfortunately, sometimes things get a little too tough and people may find themselves admitted to a mental health care facility of some nature, whether it is voluntary or involuntary. The problem with most mental health facilities is that they oftentimes lack spaces that allow patients to heal properly. It can feel isolating, and the interior environment can feel oppressive. In some cases, patients are caught in abusive or predatory situations. It's not only stressful for the patients, but also the caregivers and professionals. This is brought on by the severe underinvestment in mental health and well-being from the federal government. There is limited access, lack of awareness, high costs, and insufficient insurance coverage, as well as the social stigma that surrounds speaking about mental health. With regard to children's mental health, prior to the pandemic, as many as 1 out of 5 children aged 2 to 8 years old in the United States had a diagnosed mental, behavioral, or developmental disorder. Childhood mental disorders are described as serious changes in the way children typically learn, behave, or handle their emotions. ADHD, anxiety, behavioral problems, and depression are some of the most commonly diagnosed disorders in children. In a school environment, children's emotions are greatly amplified. Students suffer greater levels of anxiety, stress, and fear now, compounded by the isolation and loneliness caused by the COVID-19 pandemic. Today's students are experiencing record rates of mental health disorders. From March 2020 to October 2020, mental health-related emergency department visits increased 24% for children ages 5 to 11. Because of a variety of economic, environmental, and social factors, children and teens aren't getting the ample access to nature or deep sense of belonging that they need for well-being. The schools that students attend affect how they see and treat themselves, their peers, their futures, and the world around them. When designed as nurturing, nature-filled environments, schools can give students a sense of belonging, soothe their anxieties, reduce their fears, and elevate their moods. The site of my project that we will be focusing on is the Safe Haven campus in Mandeville, Louisiana. The campus was formerly called the Southeast Louisiana Hospital in 1952 and was the third state psychiatric hospital at the time. As the federal government began redirecting funds from behavioral health services, the campus suffered. The facilities and infrastructure began to deteriorate with the lack of maintenance. Closure was announced by Governor Bobby Jindal in 2012. St. Tammany Parish itself has had an ongoing mental health crisis. However, following its closure, Parish President Patricia Brister and State Senator Jack Donahue, alongside the community of St. Tammany, worked together to save and maintain the critical services taking place on campus. The parish's efforts would eventually lead to the $15,480,000 purchase of the site and culminate into the formation of the Safe Haven campus. The campus is surrounded by groves of pines. Parts of the campus house and cater to patients with specific conditions, as well as the professionals and caregivers. The buildings around campus consist of offices for the staff, apartments and units that aid those with conditions such as depression, anxiety, ADHD, PTSD, substance use, and all other manner of conditions. The facility also aids those who are unhoused. Around the campus lay large amounts of underutilized green space. Some of the buildings around the campus are dilapidated or unused, which stems from the lack of funding. My project will be focused on the healing properties of restorative and/or therapeutic design for healthcare facilities in conjunction with school settings for children as well as other patients. Healing landscape interventions can make a difference to longevity, quality of life, and the general well-being of communities. According to Mark Epstein of Havs Epstein Landscape and Architecture in Seattle, studies suggest that nature can lower aggression in mental health patients, faster healing after surgery with shorter hospital stays, less pain, increased attention span, and less anxiety and stress. Ulrich's theory of supportive design suggests that perceived control, social support, and positive distraction are integral to a patient's well-being. Utilizing specific plantings, natural materials, and sounds, and the presence of water are all elements that represent life and can help achieve these goals. For this project, we will be focusing on the areas around the Project Rise and virtual school building as well as the recreational area. Project Rise is a program meant for students who are in 1st through 5th grade who have emotional issues that prevent them from thriving in a traditional school environment. This program addresses the students' educational and emotional needs with a staff of teachers and clinicians. Right now, there is a lack of programming surrounding these areas, with the school itself only having a concrete pad within the enclosure adjacent to it, and the recreational area containing only a dilapidated pavilion and an overgrown basketball court. The proposal for Safe Haven will entail a redesign for the adjacent areas surrounding the school as well as a designated recreational area. The focus will be on children ages 5 to 11 years old from 1st to 5th grade who suffer from ADHD, depression, stress, and anxiety, as well as other patients and staff who are dealing with depression, anxiety, and stress. The concept will revolve around developing a series of spaces that connect with each other while having different themes and functions that meet the goals of providing contemplative spaces, decreasing stress and anxiety, and encouraging physical activity and sociability. Strategies can range from decorative entryways, natural screenings, sculptural pieces that create sound along pathways, to school gardens, flexible play spaces, drawing walls, and spaces designated for relaxation. Strategies for planting should involve elements that awaken the senses through the use of visual, olfactory, and edible planting. The desire is to achieve behavioral outcomes that create a pattern of positive emotional responses that help users to heal. I will be developing a site plan, a planting palette to demonstrate usage of vegetation specific to users with ADHD, depression, stress, and anxiety, sections, and a 3D model to show perspectives, as well as looking into theories that will support my research.